Hi, my name is Georgia, Veinu Georgia, and I come from Ammanford and I've been in St John for 7 years. I go to Cardiff University as a medical student and I train at the division there.
Hi, my name is Asghar. I'm from Cardiff. I've been in St John for around 20 years. I'm a paramedic with the Welsh Ambulance Service and I train with Roath Park Division.
So St John Ambulance Cymru is Wales's leading first aid charity and we have been providing first aid cover and training for over 100 years. And today we are going to walk you through some scenarios that you might come across in wild Wales.
So if I'm a Celebrity Get Me Out of Here, which has been filmed in Wales, has got you inspired to get out and venturing into wild Wales, then look no further. We've got all the advice for any injuries and illnesses that you might come across and how to treat them.
So what we're going to talk you through today is assessing the casualty, being the primary survey, bones, muscles and joint injuries, extremes of temperature, foreign objects in the eye, ear and nose, bites and stings and head injuries.
And for those who are following along, we'd love for you to get involved. We've got Stephen, one of our trainers, here to answer any questions that you guys may have.
So a bit of preparation to start. If you are going to head out to the outside in Wales, then you need to make sure that you're fully prepared. Make sure that you tell someone where you're going, what you're doing, and that you have all the kit you need for your little adventure in a bag.
Some of the things that you may want to bring along with you: a compass,
Wonderful.
a map, a nice flask of warm tea, a bottle of water. Don't forget your face covering and your gloves.
Very important.
And a first aid kit. For those who don't have a first aid kit, feel free to go online to St John Ambulance Cymru website and order one for yourself.
So remember guys as well, we are in the middle of pandemic, so make sure that you're keeping yourself and everyone around you safe.
As we go through, we'll be letting you know how of all the changes that keep yourself and your casualty from being safe.
So let's go through the first bit of the course then, which is primary survey. So remember everyone, when you come across any first aid scenario, it's really important to make sure that you do the primary survey. It's the first basic assessment that you're going to do of any casualty that you come across. In St John Ambulance Cymru, we use a very handy acronym, which is Doctors ABC, which is what I'm going to talk you through now. So the first bit is D, which stands for danger. Danger is the most important bit because it means you're keeping yourself safe and not putting yourself in an unsafe situation. This can be by removing dangers such as people that are in the way, electrics that could give you an electric shock, water that you could slip on, or maybe if you're out in wild Wales, then some logs or trees that you might trip over. A very big tree. So Az is now going to demonstrate this.
Yeah, I'm happy there's no danger and the scene is safe.
Brilliant. And the next bit is R, which is response. We use an acronym called AVPU. So the first bit is alert. If I'm standing talking to you now, then I am alert. If I was to lay on the floor and not say anything, then you would have to assess me a little bit further. The next bit is voice. You are going to introduce yourself or give a simple verbal command, such as open your eyes. If they don't respond to that, then you're going to go to the next step, which is pain. We're not actually causing any pain, we're just going to shake their shoulders gently to see if they respond. And if all of those steps fail, then we deem them as unresponsive. Like to demonstrate?
Hello, can you hear me? Can you open your eyes? I'm getting no response.
Okay, so this patient is unresponsive. The next bit is shout for help. This is important because you will probably need help in any first aid scenario, being that they might need to get stuff for you or phone an ambulance.
Can somebody help me?
So hopefully someone would come running to Az's help. The next bit is airway. We're going to do this by doing a simple manoeuvre called the head tilt chin lift. This is to open the airway, get the tongue out of the way to get it nice and open. And it means that we can have a little look inside to see if there's any obvious blockages.
Yeah, I'm happy the airway is clear.
Brilliant. And the next bit is breathing. So you guys have probably learned that usually we look, listen and feel for breath. In the current circumstances with COVID-19, we are just going to look from a safe distance to see if the chest is rising and falling.
Yeah, I'm happy there's rise and fall.
Wonderful. So with regards to the outcomes of the breathing, if they're not breathing, then we are going to move on to CPR. If they are breathing, then we're going to move on to putting them in the recovery position, and the last bit, which is C, circulation, looking for any major bleeding. In an emergency situation, make sure that you call 999, and if you are out on an adventure, out in the outdoors, then you may want to ask for the Coast Guards or Mountain Rescue. So now we'll go on to the next bit, which is muscle, bones and joint injuries.
So bone and muscle injuries can happen at any time during any activity, whether you're mountain climbing in the Brecon Beacons or whether you're coast steering in Pembrokeshire. The three main injuries you may come across are fractures, sprains and strains. Fractures, what you may see, there may be an obvious deformity where the bone is broken, there may be swelling and bruising, you may have pain, it may be difficult to move the limb, there may be a wound protruding where the bone is, and you may get signs of shocks. Sprains and strains are slightly different. The difference between a sprain and a strain is normally a ligament and a strain is normally a tendon, although the treatment is very similar.
Do you know what? I think I might have sprained my ankle myself. How do I treat it?
I've got a nice acronym for you. It's called RICE. It's rest, ice, comfortable support and elevation. Because of COVID, we're going to ask the casualty to do a bit more of the treating for themselves. So we ask the casualty to rest the injured limb. We then ask the casualty to apply an ice pack or a cold compress.
So I actually have my first aid kit from my handy little backpack, so I should have an ice pack in there.
Perfect. So we'll ask Georgia to do that for about 10 minutes to help reduce the swelling. After that, we're going to ask her to put on a comfortable support bandage. She'll do that by wrapping it a few times around the top, making sure she supports the ankle completely, and then tucking it in, making sure it's nice and sturdy. And because we're out in wild Wales, we'll have our rucksacks on us, so we can nice and easily use that to help us elevate the limb.
Wonderful, thank you.
So some of the injuries may be a bit more distressing. For example, a dislocation. That may cause the casualty to go into shock. Shock is nice and easy to treat. You just lie them down on the floor, reassure them, and raise the legs to ensure that the blood flow goes back to the brain and the vital organs. Next, Georgia's going to take us through extremes of temperatures.
Okay, thanks Az. So now we're going to go through some extremes of temperature. So obviously usually in Wales it's quite cold, but sometimes it can actually get really hot, believe it or not. In fact, sometimes it goes as high as 35 degrees, which sounds really fun. But actually sometimes it can get quite dangerous. So that's something that we definitely need to talk through. So we need to know the signs and symptoms of heat exhaustion, which is what happens when you get too hot. So this can be looking out for signs such as excess sweating, having a really bad headache, feeling sick, maybe going sick, and also feeling a little bit dizzy. To treat it, we are going to make sure that we move them to a cold, cool place, whether that's inside where there's a bit of aircon or whether that's outside under shelter. We're also going to lie them down comfortably and raise their legs to get the blood flowing back again. Make sure that they're drinking plenty of water to hydrate themselves, and you can use extra things such as oral rehydration salts and maybe an isotonic drink such as Lucozade. Advise the casualty to seek some medical help if their symptoms aren't so great, and if the symptoms are getting worse, then we need to place them in the recovery position and phone for an ambulance, phone in 999. And also in Wales, it can get really, really cold. In fact, that is what it's like most of the time here. Very, very cold. And when it is cold, we need to make sure that we look out for signs of hypothermia, because, for example, in Snowdon, it can actually get as cold as below 0 degrees. That's pretty cold. So you need to be sure that you wrap up warm and that you avoid anything like hypothermia happening. If it does happen, then you need to look out for signs such as excess shivering, which is what you usually do when you're cold. Pale, dry skin can happen. You can also get some slow, shallow breathing and also a slow pulse that you can feel on the wrist. If you see any of these signs, it's really important to treat it correctly. You do this by taking them to a sheltered place away from any cold wind or rain, or preferably indoors where it's nice and warm. If they are outdoors, you need to make sure that wherever they're sitting or laying down, that it's nice and insulated using things like bracken or branches. You need to cover the casualty in lots and lots of layers like I have here, making sure that they've got lots of blankets, and you can also use, which is in a first aid kit, a foil blanket on top of all of these layers to keep them nice and warm. You also want to make sure that any wet clothing that they may have on, maybe they've been in some cold water, that that's all taken off, because that's just going to make them colder. And you also want to give them some nice warm drinks, maybe something like a flask of tea that they might have on them. You want to make sure that you call 999, and if the condition gets any worse, then seek medical advice. So that's everything for extremes of temperature. Now we're going to move on to the next thing, which is foreign objects.
So whether it's dust flying in your eyes from your mountain biking on the Brecons, or whether you guys are doing your own bush tucker trials and insects are going in your ears and your nose, don't worry, we've got you covered for that. It might sound scary, but the treatment is very nice, is very easy for that. So all you need is just a bottle of water. For example, any injuries that are in the eye, you ask the patient to lean towards the affected side, and you just ask them to pour clean running water through until the object has disappeared. For objects in the ear, you ask the casualty to lean to the other side and flood the ear until the foreign object has disappeared. Foreign objects in your nose are a little bit more difficult. I don't recommend trying to take them out yourselves, as you may push them further inside. What you should do is then seek further medical advice and advise them to see someone who can take it out appropriately. And we'll now move on to bites and stings.
Okay, so we might not be in Australia, but actually in wild Wales we have lots of creepy crawlies ourselves, and if you're going to do your very own bush tucker trial, then you need to know how to treat them accordingly. So the most common one that we have is bees and wasps, and even though they're quite similar, we do treat them quite differently. What you might see when someone's got a sting maybe in their arm is some pain or itching. You might see some redness or swelling around where they were stung, and also there can be a little raised lump. The severity and how it looks will depend on what's actually bitten them, and you also may see some signs of allergic reaction, which we will go through in a bit. So to treat it, again, like I said, it depends on what's actually bitten them. But for example, a bee sting, a lot of the time the sting will still stay within the skin, and you need to make sure that you get that out, because the venom could actually make it worse. So to do this, what you're going to use is a credit card, because if you use something like tweezers, you're actually just going to push more venom into the skin. So what you're going to do is get a nice credit card like this, or anything that's hard, and you are going to get the head of the sting and just scrape it out, and that should get it out nice and smooth. Once you've done that, you are going to apply a cold compress, which will help with the swelling. Make sure that the casualty raises the bitten or stung part to help with the swelling, and also apply an ice pack. And if the swelling or pain gets worse and continues and nothing helps, then you are going to advise them to seek medical help. In Wales, believe it or not, we actually have snakes as well. They're not just on the telly in I'm a Celebrity. We also have adders with 50 to 100 bites happening per year. Sounds really scary, and they can hurt quite a bit, but actually there's no need to panic, they're not too serious. If you do get bitten, usually to see a snake bite, it's usually 2 holes, and that's how you know that it's a snake. If you have been bitten by a snake, then one of the most important things to do is to note the time of that the bite happened and what the snake looks like, so that people further on down the line, like paramedics and doctors, know exactly what's bitten them and how long they've had the venom for. You then need to help them to lie down, keep them calm and keep them still. You need to raise the head and shoulders, and you need to immobilise that part that's been injured. You also need to reassure them, like I said, and call 999, because an ambulance is really important in this scenario. Apply a pressure bandage to keep some pressure where it's been bitten, and monitor their vital signs to make sure the situation doesn't get any worse. Now, with any sort of bite or sting, you can also get what we call an allergic reaction. Some people can have allergies to these. Make sure that you look out for the signs of them and treat them, or even worse, so people can have a severe allergic reaction called anaphylaxis, or maybe even cardiac arrest. And if you want to know how to look out for these signs and treat them, then head to the St John Ambulance Cymru website to find out more. And the last part is head injuries with us.
So head injuries can happen at any point, whether it's a small bump on the head or a large injury from falling potentially off a cliff. The minor and major head injuries, the symptoms are fairly similar initially. So what you might see or what you might have is a brief period of decreased responsiveness following a blow to the head. They might have a loss of the actual incident, so a little bit of memory loss, just a mild headache, maybe a bit of dizziness and nausea. They may be slightly confused, and there may be a slight superficial wound that you can easily treat by applying a bit of pressure. So what you should do for a minor head injury, just instruct the casualty to sit down and relax and reassure them. Control any bleeding that you can see. Ask the casualty to apply pressure. If there's any swelling, ask the casualty to apply a cold compress or an ice pack. You need to monitor the casualty's vital signs for any deterioration, and if and when the casualty recovers, you need to make sure that they're being looked after by a responsible person. For a severe head injury, what you may notice is that the casualty becomes more unresponsive. They may have unequal pupil sizes, and they may, in severe or extreme circumstances, they may have blood or straw-coloured liquid coming out from their ears. What you should do is dial 999 straight away. If the casualty is responsive, instruct them to sit down and reassure them. You need to control any bleeding that may be going on. If the casualty is unresponsive, you need to maintain the airway like we learnt earlier. You need to monitor the vital signs and note any for deterioration. Some of the red flags with any head injuries that you'll need to look out for is if the casualty is kind of older, over this age of 65, if they're taking any blood thinning medication, and if they have been sick, or if they, in a worst case scenario, start to have seizures.
And that's it. Thank you for attending our Wild Wales First Aid Training course. And remember, after every first aid scenario, you are going to wash your hands and remove any gloves, masks or aprons that you might have used.
Remember, Steve is still on, is able to answer any questions for you guys, so please feel free to keep them coming. And we'd love to have your feedback, so feel free to follow us on any of our social media sites, which is at SJA Cymru.
Your support for our work is vital. We rely on people like you to make donations to help us keep saving lives and teaching everyone out there to do so as well.
Your donations would mean the world to us to help us keeping the Welsh community safe. So if you can give anything, then please click the link below.
Or even some fundraising ideas. If you head to the St John Ambulance Cymru website, you'll find the Wild Wales fundraising pack, where you'll see some I'm a Celebrity ideas to help you fundraise for us. And also, if you want some more information on volunteering or some training courses that we do for the community, businesses or schools, then head on over there as well. Thank you everyone for coming, and stay safe. Diolch yn fawr.
Thank you, diolch.